Whenever you are going to see a patient, we call them as a magic box, because it keeps on surprising with the clinical presentations and the disease itself. And that's because this particular covering that this abdomen has, which is way variant and way different than that of anything else that we have, which is known as the peritoneum. Now for that reason, this particular abdomen have a different way of clinical presentations, which may not be matching with the book thing or with the common clinical presentations. My advice to you, whenever you are hitting the clinical scenarios with dealing with any patients with abdominal problem, just before going for a sure thing like a sure diagnosis, you just like keep a second thought about the abdominal diseases. But this is one of the complex region I'm just like want to brush through quickly before we finish this particular anatomy session off, is that we have this cavity divided into two parts, abdominal cavity proper and the pelvic cavity true false we have. Now I will be focusing on this particular abdomen with this particular cavity which is lined by a thin membrane, we call them as peritoneal membrane or peritoneum, which has got two layers, visceral layer and parietal layer. Now visceral and parietal we are familiar with, have got differences in terms of like nerve supply, in terms of like a clinical presentation, blood supply, lymphatic, etc., etc. Now this particular peritoneum in this abdomen have a cavity inside to it, we call them as peritoneal cavity, which is largely divided into two parts. The moment you open this abdomen cavity like this, you get into this particular cavity, we call them as greater sac peritoneum cavity. And behind this particular stomach, we find a hidden space, we call them as lesser sac. So this particular peritoneal cavity is divided into two parts, greater peritoneum cavity, we call them as greater sac, and the lesser one which is present in the lesser sac. So this particular lesser sac and the greater sac is kind of important to us. Now this particular peritoneum have got some modifications or some changes, and these particular changes basically trouble us to find a abdominal problem or pathologies. We call these particular modifications of the peritoneum in three headings in proper, like beside this particular peritoneal cavity, peritoneal reflections, peritoneal ligaments and peritoneal folds. All are important for us because each of these particular contained our exam question, MCQ or large question or short questions, etc., etc. So we have to know about this particular reflection. That means it's representing just like light hitting some kind of like obstructions and then moving from that obstructions in right, left or upper or lower directions. That's why we call them as peritoneal reflections. Now this peritoneal reflection, two of this we have to know about, greater omentum and lesser omentum. The point is the MCQ is what does it contain, the greater omentum, and likewise the lesser omentum, what does it contain. So this particular blood vessels is a point of concern for us whenever we are talking about this particular greater peritoneum with this particular content of the blood vessels. This greater peritoneum or greater omentum, we call them as greater omentum as a policeman of abdomen because it can have a moving capacity so that it can move over different parts. Coming to this particular lesser part of this, we call them as lesser omentum. That means it is falling from the liver to the stomach. Now it has two parts that we have to understand, hepatogastric and hepatoduodenal. That means this margin and this margin that is separated from, and then we have an opening, we call them as free margin of lesser omentum. This free margin of lesser omentum is basically the space where you find this epiploic foramen. You have to know in and out about epiploic foramen. Why? Because if you are opening this abdomen, this particular greater omental sac you are opening. Now any abdominal diseases or any surgery, if you are doing, this space is open to us, but this hidden space which is lying behind the stomach may hold some kind of secretions. So for that we have to drain this during or after surgery so that before you close this abdomen, this space needs to be cleaned. So that's why we have to know about this particular foramen which is known as epiploic foramen, which is gateway or only gateway to this particular lesser sac, which is a hidden pouch behind the stomach. Normally we cannot reach to that particular space, that needs to be drained out through this foramen. So you have to know the boundaries of this epiploic foramen, the relationship of this foramen and a clinical significance that we are familiar with. So, this lesser omentum, the parts of the lesser omentum and this particular move forward again, and the content of this particular lesser omentum that we have to know, and this particular free margin that we understand over here is a thing which you have to keep in mind. The third reflection is the mesentery or the mesentery, which is holding the coils of small intestine. Again, point of interest for us is that what are the blood vessels that is present in it, which could be our MCQs, or the mesentery itself is a short note. So, we do not ask you this like a long detail about it, we just like have to know how this particular mesentery is: attached margin, free margin or free border, attached border which is present on this side, and this particular free margin which is going on this particular side, which is holding this particular coils of small intestine, and how far it is extending from the right to left, that you have to just like I mentioned over these regions. So, this particular elements about this small mesentery that you have to know about. Then this particular thing which you often forget about, which is known as transverse mesocolon, which is wrapping around the transverse colon and bridging with this greater omentum and holding this important blood vessels. Holding this blood vessel, we call them as middle colic vessels. This is the important. Again, in case of this abdominal surgery, if you are going to do any explorations, these branches need to be kept well. So, if you have a trouble or ripped of this particular middle colic blood vessels, that means this transverse colon and as well as ascending, descending colon or these flexures are at trouble. So, this particular transverse mesocolon that you also have to keep in mind, knowing this particular middle colic blood vessels which is present in it. So, this particular all these elements are MCQs, contents of this particular peritoneal reflections and the clinical importance to it, that you have to keep in mind. Third, last not the least, is sigmoid mesocolon. That means it is holding this particular sigmoid colon which is going to become this particular rectum. Now, why is this important? Because this particular point we have a chances of carcinomas. The cancers of this large intestine is pretty common, and this particular sigmoid mesocolon holds these things up and wraps these things up. Again, this particular region holds these blood vessels, we call them as sigmoidal vessels. So, this particular sigmoidal vessels, which is a content of this along with the fat and peritoneum and lymphatics, is an important landmark that you have to keep in mind when it becomes significant in case of dealing with the cancers of this particular region. These are all your lifetime clinical cases that we are going to do. Again, this anatomy knowledge, you have to come back to understand what this particular thing we are dealing with. Mesoappendix. This is again very important because appendicitis or acute appendicitis or chronic appendicitis or appendicular disease is pretty common. So, if you are just like dealing with the surgery of the appendix, you have to reach to this particular space where the blood vessels is there. Blood vessel is present within this particular thin strip of peritoneum, mesoappendix, and you have to just like catch this particular appendicular vessels, ligate it or block it or just like put a suture to it, and then you just like remove this particular appendix and suture it. So, this particular again mesoappendix is a MCQ and as well as clinical important content. Now, coming to these ligaments, so likewise these reflections, the ligaments you have to know which are related to this particular upper abdomen and lower abdomen, and again the content of it. So, we call this particular peritoneal ligaments which are kind of important to us in relation to this particular stomach, spleen and this particular kidney region. We call them as gastrosplenic ligaments. From the stomach to this particular spleen it is running. What it is holding? It is holding this particular short gastric vessels. The short gastric vessels supplies this fundus of the stomach. So, if you are going to do any surgery in the spleen, say for example splenectomy surgery, you are going to remove this spleen for any kind of or any diseases. We have to just like catch this particular region over here. So, if you are disturbing this particular region with this gastrosplenic ligament, we are basically ripping this particular gastric vessels. This gastric vessel supplies this fundus of the stomach, which is producing a number of the gastrines and other substances, which is basically regulating this particular secretions of the stomach. That is why this particular peritoneal ligament, the content of it is important. Another one is lienorenal. That means from the spleen to this particular kidneys, we have this particular thin strip of ligament which is there. What is holding over here? Splenic vessels. That means again in case of splenic surgery, you have to work in this particular ligament, clamp this particular artery to just like remove this. Now, point is, within this particular region, along with these particular vessels, we have a tail of this pancreas present to it. So if you are removing these particular blood vessels without taking care of this tail of the pancreas, we are inviting the loss of islets of Langerhans, which may lead to type 2 diabetes. Afterwards, patient recovers from this particular region. So this is what we are clinically important of, or we should be emphasizing or remembering whenever you are studying on this region. So these ligaments are your all MCQs in a throughout life. This examinations or in a final MD examination, these particular ligaments may be given with the pictures like this. We have to identify this and blood vessels which is present to it. You should be able to identify it. Falciform ligament, this is very commonly been picked up in examination related to the liver. What does it mean? Which is a kind of like a developmental significance as well. And what does it contain along with this particular region over this particular falciform ligament, like ligamentum teres hepatis, which contains this paraumbilical veins, which is kind of like an important content to it. Ligament of teres, we have to know about what this particular ligamentum teres, which is remnant of, and how does this falciform ligament continue. So regard to this particular falciform, why it is called falciform? It looks like a half moon, sickle shaped. So this falciform ligament goes from this particular liver substance, pierces it and goes to under surface of the diaphragm above and falls anteriorly and inferiorly to the anterior abdominal wall up to this umbilicus. So extent of this falciform ligament, again the content of this could be your exam short note. Just like a very brief 3-liner, 4-liner explanation with a schematic picture will cover a 4-mark exam questions. Moving to this, we have this right coronary, left coronary holding this particular space, like we call them as like the bare area of the liver. We understand the significance of it. The bare area, which is non-peritoneal surface of the liver head has, and if you have any kind of visceral impressions on the right side burial area, which is right suprarenal gland related to this particular the bare area of this particular region. Now coming to this particular other content, which is known as peritoneal folds. Again, peritoneal folds becomes very important because through this particular peritoneal fold, we have this particular blood vessels running or moving along with that. So we have this particular thing which is visible if you just like open the abdomen, see from inside out. So just like under to this particular abdominal, anti-abdominal wall, we can see this particular folds, like median fold, medial fold, and this particular lateral folds, which is present to this particular region. Click corrector. So we have 3 of them. We call them as median umbilical fold. That means we have a streak present in the midline, which is basically continuing from the urachus, which is related to this particular urinary bladder. And we understand this urachus or the kind of weeping umbilicus, etc., etc., having a clinical importance to it. Lateral to it, we have this particular medial umbilical fold, which is basically created by this particular ligament, which is coming from this obliterated umbilical artery. Doesn't have much of clinical significance, but this is an important plane. The third or the important over here is this lateral umbilical fold, because under to it, which is created by this fold, is inferior epigastric vessels, which is important landmark for doing this region surgery, which is known as the hernia surgery, etc., etc. We call them as Hassel's back triangle, which is related to this particular artery, holds this particular surgery, which basically separates us to identify this particular direct hernia or indirect hernia. So these particular ligaments or folds, they are very important to us to understand in this particular regions. Other than this, we have this particular peritoneal folds, which is related to the pelvis. We call them as this peritoneal fold in this pelvis between this female and male subjects. They are there, and the content and the significance is there. So anterior to posterior, in female we have 3 organs placed: urinary bladder, uterus with this cervix and the vagina, and then we have the rectum. Between them we have this particular space. We call them as recto-vaginal or recto-uterine pouch, which is pouch of Douglas, deepest of all and dependent most part. That means if we are standing in positions, this particular fold, which is known as recto-uterine fold, is the deepest one. So any fluid, if it is there, which will be trickling and settling there. This particular fluid can be drained out through a surgery. We call them as caldoscopic or posterior fornix. Through this particular posterior fornix of the vagina, you can reach to this part and drain this. So if you have an abscess over here, we call them as pelvic abscess, which can be drained through this posterior fornix of the vagina, which is a non-invasive surgery. Then we have this particular fold which is between the urinary bladder and the uterus. So we call them as uterovesicle, which is uterus to vesicle, which is having this particular fold which is coming on this region. This particular uterus basically sitting on this particular superior surface of the bladder and allowing this particular space to be obliterated. If it is not obliterated, that means this uterus is falling back. That means this prolapse of the uterus which happens in case of the retroversions of the uterus. Now, other than this, in case of the male subjects, we have this particular only space which is existing in between this rectum and the vagina, vesicle. We call them as rectovesical fold, which is present in this region. So, in case of this pelvis, we have these particular spaces which you have to understand the clinical significance. Greater sac and the lesser sac, which you have to understand the positions of it and the communications between them, which is move cord, lying to this region through this particular foramen. We call them as epiploic foramen. This is the important region. Again, I cannot emphasize enough why this particular space is important, because this is the only way we can reach to this particular posterior space, which is important for draining this particular region in surgery, or in case of this particular abscess or any kind of fluid accumulation. If it is there, it may be occupying in this particular lesser sac or this particular hepatorenal pouch or Morrison, this area. That's why this particular area is having an utmost clinical importance. In case of the epiploic foramen, which is lying in this, anterior to that we have the free margin of lesser omentum. Then lesser omentum, which is extending from the stomach to this particular duodenum, have got two parts, and the free margin of this particular region have got important clinical anatomical significance that you have to keep in mind. So, this omental bursa, which is lesser sac, that you have to keep in mind, it has got recesses and the communications move cord to it, which is known as epiploic foramen, which is important to us, and you have to know the boundaries and this particular spaces which is present to it. Apart from that, we have these particular spaces in this particular greater sac, which is known as this particular, so we have these spaces in this particular region, we call them as subphrenic, that means under this particular diaphragm, and this subhepatic spaces. So, which can be divided into right side, left side accordingly, separated by this particular falciform ligament or the presence of the ligament, presence of this particular lever. Out of this spaces that we have, out of this we have this particular subphrenic space or hepatorenal pouch, which is related to it, and subphrenic abscess is important to us. Many a times we see these particular patients because abdomen has large capacities. The patients may not coming with these particular problems like pain abdomen, etc., etc. They may be presenting with these irritations of the diaphragm, which can be coming with this particular problem with this tip of the shoulder or hiccup. So, many a times we seen in our clinical life, the patient is coming like hiccup, cannot control the hiccups, which is the prime problem, and we search throughout, we cannot find anything. We put a tube through the stomach, we find anything, until we do this CT scan or MRI to the abdomen to find this particular small occupations of this particular abscess. Sometimes we have a liver abscess. In case of the liver, we have a disease, we call them as amoebiasis, or amoebiasis, which is commonly we call them as amasha in case of like Bengali language. So, this particular amoebiasis may be holding or this particular affecting this liver, creating a bump, we call them as amoebic liver abscess. So, amoebic liver abscess may be just like pushing this particular region, bursting into and making an abscess, we call them a subphrenic abscess, which may be irritating the diaphragm under surface, presenting with hiccup. So, diaphragm, if it is irritated, it is contracting this particular phrenic nerve and contracting this particular diaphragm with this motor innervations and creating this particular spasmodic contraction, which is presented as hiccups. So, this particular thing, subphrenic abscess or pain on the right shoulder tip or hiccups are common presentations with this subphrenic abscess or subphrenic regions. So, abscess, which is kind of very important to it, and hepatorenal pouch, the boundaries to it, the relations to it, we have to understand very well. So, peritoneal infections, peritoneal abscess, flow of the peritoneum, how you are just like going to nurse this particular patients, and why this particular posture is important, because if you keep this particular lying down, this infections is settling down into two space in this particular peritoneum and under this particular diaphragm. So, there are two space will be there, this pus or the infections may be occupied if you ask the patient to lie down. So we do not want this to happen, rather we try to just like settle down the infections in the lower part of the abdomen. We ask the patient to be in supine or reincumbent positions so that the pus or anything which has to trickle down to this particular pelvic cavity. So the flow of this particular fluid which will be pelvic cavity ward. So these infections will be limited to this particular pelvic region, and then we can do this particular surgical process to drain this one spot out. So this is this particular logic of keeping this particular pelvic or peritoneal infections, keeping this particular patients in upright positions than that of supine position. Infection spread can be arrested by this particular omentum. We call them as greater omentum. So this particular omentum is working as a natural barrier. That means it is holding these particular infections in situ. That's why we call this peritoneum as policeman. Second thing, the infections of the abdomen or pelvic cavity is more common in case of the female subject because it is open. So this, in case of the female subjects, this particular pelvic cavity or the peritoneal cavity is open because of this particular vagina, cervix, uterine cavity and the fallopian tube is open into the abdominal pelvic cavity. So infection can ascend up or climb up from this particular uterus to this particular the abdominal cavity. So this particular infections in case of this particular female subjects are more common in case of these particular individuals than that of male subjects. Again, this is an important thing that we have to mind about. So this is a short, again this peritoneum will be coming again and again in your clinical life, in pathology, in microbiology and as well as in surgery, medicines. This particular content will be coming back, as well as anatomy. Keep on asking about MCQs about this particular peritoneal reflections and the peritoneal folds. Why these are important? Because any step you do in the surgery in case of the abdomen, you have to deal with the peritoneum. If you do not have a proper idea about the sac and the peritoneum and the ligaments and the blood vessels which are present to it, you are going to have a botched surgery or a messed up surgery. That messed up surgery if you have, you are going to have a lot of lawsuits. That means you are going to earn money and ruin the money paying these persons who are legal persons. So that's why peritoneum is the thing you have to study really well before going for any surgical interventions, going for any gynecological procedure, going for any kind of procedure which is leading to the medicinal thing. So this is all.